Insulin-dependent diabetes mellitus has a serious impact on the lives of many patients all over the world.
The disease severely complicates daily life, requires expensive and complex treatment and care methods, and in particular generates high costs. The illness results in many related problems as well, not only for patients and their families or their doctors and caregivers, but also for health insurance companies and funding agencies. Above all, the detailed diabetes diaries that patients must keep are cumbersome, which means they are often improperly or incompletely filled out. The consequences are mistakes in the insulin dosages, poorly calibrated metabolism, and failure to adhere to the physician's recommended therapies. In addition to acute problems, this also increases the mid to long-term risks of contracting secondary complications related to diabetes mellitus.
With Azista, the firm EMPERRA offers a highly innovative and holistic product to improve the diagnosis and therapy of insulin-dependent diabetes mellitus, an automatic documentation and monitoring system. Continuous automatic transmission of all relevant treatment data, both to the patient and his or her authorized doctors, provides a safe, simple and flexible solution to aid in the treatment of insulin-dependent diabetes mellitus. Diabetes mellitus is a widespread disease which has become a serious problem, especially in industrialized nations, but increasingly also in developing countries. In addition to genetic factors, the disease has become a major health problem, above all due to an aging population, improper nourishment, and lack of exercise. It's estimated that 10% of Germany's population suffers from the disease, and the numbers are growing. Not only the elderly are affected, it strikes people of all ages. Diabetes mellitus is also often associated with serious medical complications and secondary illnesses. Patients' daily lives are markedly restricted, and the costs incurred for society and the healthcare system are immense. But what exactly is diabetes mellitus?
The cells in the human body need glucose to produce energy. This is essential for every cell to function. The carbohydrates consumed in food are absorbed into the bloodstream as glucose through digestion. Normally, this blood sugar is then channeled to the cells by the pancreas hormone insulin. In diabetes patients, this natural function is considerably impaired. There are basically two groups of patients with insulin-dependent diabetes mellitus. There is the so-called diabetes mellitus type 1, where the pancreas is no longer able to produce insulin for the body, whereas in type 2, the cells have lost the ability to respond to the insulin that is produced. The crucial aspect, though, is this. People suffering from type 1 diabetes or more severe forms of type 2 diabetes require injections of medicinal insulin. This is prescribed by their doctor, but the patients are responsible for injecting the insulin themselves.
And this is precisely the point at which the patient's self-management of diabetes begins. Here's where Azista comes in. Patients who have insulin-dependent diabetes mellitus are required to inject the medically prescribed dosage of insulin hormone under their skin themselves on a daily basis. This requires regular monitoring of blood glucose. This information must be meticulously recorded in a diabetes diary, but this is a complicated and time-consuming task.
Scientific studies have shown that despite intensive efforts by physicians and government programs, about 80% of such diaries are kept imprecisely or even contain incorrect entries. The reasons for this are lack of time or knowledge, carelessness, and even vanity. The consequences of poor record-keeping can be grave, resulting in inadequate insulin dosages. This can lead to serious complications, such as heart attacks, strokes, blindness, kidney or neural diseases, or even limb amputation due to poor blood circulation in the extremities. Further aggravating matters is the general shortage of doctors in Germany and other countries. This makes specialized and comprehensive care of diabetes patients considerably more complicated.
It's therefore time for an innovative and comprehensive solution. It's time for Azista. Asysta is the integrated telemedicine system for diabetes patients being treated with insulin. The Asysta system can be used quickly and easily anywhere, requiring no further effort by the patient or the doctor. The equipment supplied transmits all saved data to the Asysta online portal, even when the patient has spent longer periods away from home. Whether inpatient, outpatient or home care, Asysta makes the work of doctors and treatment teams simpler and more efficient. And it makes life easier and safer for insulin-dependent diabetes patients, as well as offering security to their relatives and caregivers.
Patients continue to measure their blood sugar as usual, using the Asysta blood glucose meter and Asysta test strips. The measured blood glucose levels are comprehensively saved and automatically transmitted wirelessly to the Asysta portal via the Asysta base. There is also an additional option for patients to input bread or carbohydrate units to be saved and transmitted. And all injected long-term or short-term insulin values are stored on the Asysta pen and automatically transmitted to the patient portal. The Asysta portal provides the patient with a complete and continuous record of the measured blood glucose values, bread units, and insulin doses in an analyzed format, which is personalized and in full compliance with data privacy regulations. Patients can also log on to the internet site using their usual browser as well as via Android or iOS EMPERRA apps. Since authorized medical personnel receive the same information simultaneously, fast and simple communication between doctor and patient is made possible, even over long distances. The benefits of this are obvious: improved therapy safety, better quality of life, and lower treatment costs. And Asysta offers more advantages. The insulin vial adapters allow all insulin cartridges currently on the market to be used in the Asysta pen. This means doctors and patients can continue to use the same insulin product they have been using, and changes in the insulin therapy are uncomplicated and easy to make as well.
All of the hardware and software components of the Asysta system are, of course, certified medicinal products available to patients with a doctor's prescription through any pharmacy. The set includes all the equipment required: insulin pen, blood glucose meter, test strips, insulin vial adapter, and a transfer station. Asysta is a genuine win not only for doctors and diabetes patients, but also for health insurance companies and funding agencies.
Long-term economic studies on health have shown that the average treatment cost per diabetes patient has risen sharply over the last 20 years and is projected to continue to do so according to all current forecasts. The number of diabetes cases has also grown significantly over this period, which has led to even higher cost escalation. The expansion in cases of diabetes is linked to an increasingly aging population and more widespread risk factors such as unhealthy diets, obesity, and a lack of exercise. The treatment of diabetes mellitus alone costs the German healthcare system approximately 42 billion euros each year. Ancillary costs, such as employee disability, add another 19 billion euros annually. According to recently published studies, a single patient with diabetes costs the German healthcare system about 3,100 euros per year more than a person not suffering from diabetes mellitus. And this only takes into account such direct treatment costs as blood glucose strips, tablets, or insulin. Implementing the Asysta system can reduce these costs significantly. In addition, Asysta is a comprehensive telemedical platform that helps to counteract the acute shortage of doctors in Germany and to reduce the resulting gap in healthcare services. For instance, using the Asysta system allows a family doctor in the country and a diabetes specialist in the city to work together in treating a patient.
The Asysta system can help the healthcare system as well as everyone who pays for health insurance, while also relieving patients and their doctors of a lot of effort and saving time.
Es gibt unglaublich viele Diabetiker, die Zahl ist tendenziell steigend und Sie können natürlich deshalb die Patienten nicht alle Woche herbestellen, sondern Wir sehen sie in größeren Abständen und können manchmal auch Probleme, die sich in der Häuslichkeit ergeben, gar nicht so schnell behandeln.
Real-life experience in medical practices where the Assista system has been implemented clearly show that it can greatly simplify doctors' efforts in treating their diabetes patients.
Nun, es zeigen sich diverse Vorteile sowohl für den Arzt als auch für den Patienten, um den geht es ja vorrangig. Wir sehen zunächst mal, dass wir sehr zeitnah und zuverlässig Daten bekommen, können damit auch wesentlich besser beurteilen, wie die Therapie umgesetzt wird.
Und für den Patienten sehe ich einen großen Vorteil darin, dass er halt nicht jedes Mal zum Arzt rennen muss, wenn er mit seiner Therapie nicht zurechtkommt. Sie fühlen sich oft individueller betreut, weil ich sie halt dann wirklich kurzfristig anrufen kann oder per Mail eine Nachricht schicken kann. Und gerade bei der mäßigen Versorgungssituation auf dem Land ist es zum Beispiel gut, wenn die halt nicht so weite Wege fahren müssen.
The record of patient data on the online-based portal gives doctors round-the-clock access to the current progress of their patient's disease.
Ich gucke in regelmäßigen Abständen mir bei den meisten Patienten, also so ein Ampelsystem, da sehen sie relativ schnell, ob irgendwas nicht stimmt. Gucke mir auch gezielt bei bestimmten Patienten, wo ich die Therapie umgestellt habe, die Werte an und kann dann eben entsprechend reagieren.
Also insbesondere bei dem Klientel, welche regelmäßige Arztbesuche nicht in dem geforderten Maße wahrnehmen kann eine telemedizinische engmaschige Begleitung letzten Endes dazu führen, dass persönliche Beeinträchtigungen, Komplikationen der Erkrankung verhindert werden und damit auch wirtschaftliche Folgekosten reduziert werden.
Medical practices, but also nursing services and clinics, can view the patient's self-treatment data and analyze or optimize it where necessary, and all of this can be done quickly and conveniently.
Sonst sehe ich die Patienten in sehr großen Abständen und so können sie zwischendurch auch gucken, stimmt irgendwas nicht und ich kann die Therapie wesentlich schneller anpassen.
Interessant an diesem System finde ich, gerade im Vergleich mit anderer Praxis-EDV-Software, dass Veränderungen sehr rasch umgesetzt werden können, dass also die Anwenderfreundlichkeit sehr hoch ist und dass insbesondere die Fokussierung auf einzelne Aspekte eines Dokumentationsschemas, dass das ungewöhnlich gut gelingt hier.
EMPERRA's telemedical Assista system is the solution for the treatment of insulin-dependent diabetes patients.
Assista is easy, safe, and flexible to operate. It allows diabetics, their families, their doctors, and medical staffs to work together to optimize treatment. Assista makes daily life simpler and provides the basis for significant improvement in diabetes management. Assista can help patients avoid dangerous secondary complications, as well as saving time and money, and improve the quality of life for people who suffer from diabetes mellitus.
Assista. Perspectives for a better life.